Hi guys, welcome to today's video. In today's video we have two different patients and the first one wants to talk about some things that she's seen online that might help with her peripheral neuropathy. And peripheral neuropathy is a tough problem, and there's so many little scam kind of operations out there aimed at people who want to regain the feeling in their feet. If you don't know what it feels like, it's like walking on 2 blocks of wood. You can't feel the ground. You don't know where your feet are in space. So she wanted to ask about one of those. And so here is that video. I hope you enjoy. Okay. So health has been good since I saw you last?
Yeah.
Okay.
Okay.
Any new problems?
No.
Okay.
So you did my friend, and she's very impressed with you.
Oh, let's clarify. I did your friend. I saw your friend as a patient?
Yeah.
Okay, just clarifying. And you can tell me after the camera's off who that was, but thank you for the referral.
Sure.
You know, with HIPAA, we're no longer even allowed to send out those little postcards we used to send that say thank you for referring so-and-so.
You're not allowed to do that anymore?
Because I'm not allowed to tell you she was here.
Oh, please.
I know.
It's sickening.
Yeah, we used to be able to send you out a thank you card, and sometimes if you're a high referrer, we would send a little gift card, but we're not allowed to do any of that anymore.
Such bullshit. They all need to get a life.
Well, there are times when it's helpful and appropriate.
Yeah, but that's just dumb.
Yeah.
What reason couldn't you say thank you?
Because then you would know that she was my patient.
Oh,
And
that I sent her to you.
right. And
then I would know that she came.
Yeah.
So stupid.
yeah, well. Why is this whole nail here loose? Do you want me to cut it off as far down as it's not attached so it doesn't get pulled off?
Sure.
Okay.
Is it gonna hurt?
No. When it's loose like this, the skin underneath is already toughened up. So it's just like this skin right there.
Yeah.
And so it won't hurt. I would just be nervous that with this being so loose that your sock would snag it or something.
Okay.
And it would get ripped off.
Oh, that's pretty.
Well, when spring comes, if you get pedicures,
I don't.
okay, then no one's going to notice.
No, I don't let anybody touch my feet except you.
Wow. That's a lot of responsibility, you know?
Well,
But thank you. That's a compliment. Take a little bit more off of these. And this right here, this is just skin. It's a piece of dead skin. Yes.
can I talk with this thing?
Yeah, I mean, it's recording, but nobody knows who you are.
What do you think about the thing I see advertised for neuropathy? You go to a place and I don't know what they do, but
If it's what I'm thinking of, it's the one with the cold laser or infrared light. Mostly they're scams, although I have had a patient tell me that they got great relief from it. So some of them will bill Medicare, and some of them you pay out of pocket. Most of them do not have a doctor associated with them. So a lot of them are kind of scammy, but if it's something you wanted to try and it's just the light therapy, it certainly can't hurt anything, except your bank account.
how much is it, you know?
They tend to be pretty expensive, and if they're going to bill Medicare, they'll set you up for like 10 visits. So it depends on which company, and it depends on what the treatment is. And then I think if it really worked scientifically and studies showed that it did, neurologists would be all over it. Because if you can cure neuropathy or move it backwards, you'd be like a Nobel Prize winner.
Yeah, for sure.
So they can't hurt. Do I think they help? I would say absolutely not, except that I did have one patient come in who told me it made all the difference for them. So I never say never, but go in skeptical.
No, it's not. I mean, I'm not doing anything that. Blinking.
Yeah.
That's okay?
Yeah, it means it's on. Now I just want to talk about one thing here. There's a little dark spot there that would be a concern if it hadn't been there forever and looked the same, which is why we document them in the chart.
So it's the same?
Yeah. When you go for a full skin check by a dermatologist, you always want to make sure they look on the bottoms of your feet and in between your toes, because you can get melanomas on your feet. It's not common, but it does happen.
Well, it's interesting. I've got an appointment with one next week.
Oh, good. Yeah, just show her that, or him. Just show them that, and you know, just so they can document it and go, yeah, nothing's changing, it looks fine. Hem your socks. But everything here looks good. Now, I still feel like 3 months is too long because these nails were really long.
So do I.
Okay, so let's back off a couple weeks at least, and let's go 2.5.
Okay.
And then we can even back it down to 2 if we have to.
Okay.
Thank you for letting me video.
My pleasure.
Now for our second patient. This is a very nice lady, but obviously haven't seen her in a while. She's headed into a total knee replacement on the opposite foot, and this toe has been bothering her a lot. It's very painful. So I know that in the comments people are going to ask, why didn't you numb it up immediately? And the answer is that, number one, I didn't know how painful it was going to be. Number two, by the time we got to that point, it was so close to being done that if she could just tolerate it for another 5 seconds, we'd be done. And the injection would take 30 seconds, and injections are always uncomfortable. So a little jump scare in here, and so I hope that you enjoy this video too. How long has it been like this?
Oh my gosh. Maybe 3 or 4 years. I mean, it took that long to grow out this much.
Well, I'm just going to trim back and take off anything that's not attached. And the skin underneath is already toughened up.
Oh, okay.
Was that pain or just surprise?
It was pain.
Okay. Sorry. My goal is to not make you hurt.
Yikes. Ooh. Ah. Ooh. 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 That is so tender. Oh, wow.
Okay, I'm really sorry. It's because it's digging right into the skin.
Yeah.
I mean, there's no blood, but...
Yeah. And that's what's been hurting.
Is this area over here?
Yeah.
Okay.
Yeah.
So it might hurt. This is the... I don't know what that is that's hurting so much. Okay, let's do this. I'm just going to go very teeny tiny bites here.
Yeah, wow. Ooh, ah.
Yeah, I think it's just because it's digging into the skin.
Ooh,
I know. I'm so sorry.
Sorry.
Okay, we can be almost done. Do you want me to numb the toe up instead? I think we're pretty close to done here.
Okay.
Keep breathing. Okay, does that feel a little better over here?
Yeah.
Yeah. It was just digging down into the skin there.
Yeah.
I'm just pointing. I didn't. Okay. So let's just see if we can get a little bit more. So let's make an agreement to not let this get so bad again.
Oh, okay.
Let's get you in, even if it's once a year, because I hate causing people pain, and I know that this is really tender.
Okay. Something's not right.
Right. And it's, you know, the analogy I use is like if you put a really tight rubber band around your wrist and you left it there, it would become like out of proportion painful.
Uh-huh.
And that's kind of what's going on here.
Okay.
It's not that anything is ingrown. There's no break in the skin. It's just that it was digging very hard into that nail edge there. So let me just use my sander and see if I can get a little bit more of that thinned out right there.
Okay. So do you think that's like a normal nail?
No. I think there was some kind of injury.
Well, I dropped a 16-ounce can on it.
Okay, and so what happens is when you injure the nail growth center back here, then the nail it produces is usually thick. And it can grow so that it doesn't attach to the skin under here. That's just more debris, dead skin and stuff. that hurt over on the side here still? I'm going really light.
No.
Okay. Okay, so what I'd like to do is see you back. So you're having your left knee done in a month.
Yeah,
So let's have you come back in about 2 to 3 months.
okay,
And this won't be so sore, so I'll be able to trim it back a little bit more.
okay.
Because right now I feel like if I did that, I would just be torturing you. And I think this is enough that you'll be comfortable during your rehab.
Good.
So when I press on that now, does that feel pretty good?
Yeah, that feels pretty good.
Okay. So we'll leave it like this, not perfect. But next time you come in, it won't be so painful, especially up in that corner here.
Yeah, yeah.
So I'll be able to trim it a little further back and thin it out a little bit harder.
Okay.
Okay?
Oh my gosh.
So this will give you no trouble now during your knee rehab.
Oh my gosh. I'm so glad I got in here today. Do you think this will eventually kind of straighten out, or is that
Probably not.
really?
Probably not.
Ooh.
So it'll just take, continuing to smooth it straight across. It's not going to naturally want to go that way. And then this side is growing down. So there's a procedure we can do. You've got bigger things on your plate right now. But we can just remove the edge of the nail and have it not grow back. But we'll talk about that after your knee surgery. All right. Well, thank you for letting me video.